Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So in today's video, we're going to be talking about the difference between normal aging and potential signs of dementia. Now, one important thing to understand is that dementia is not a part of normal aging. It's not a part of the normal aging process. Now, is it true that as a person gets older, their risk for dementia increases? Yes, age is the number one risk factor. But if a person develops dementia, that means that there's something else going on beyond just age, okay? Now, there is some confusion as to, okay, well, what would be considered normal age associated changes versus potential signs of dementia? And honestly, I think that this confusion is further fueled by the fact that, as a whole, generally speaking, the world is not very healthy. So when we think of people aging and some of the issues that they have, we begin to normalize it, although it may not actually be normal. Okay, so I want you to keep that in mind. So let's start with normal aging. So as a person gets older, it is normal for them to experience what's called cognitive slowing or slowing in thinking, and it may take their brain a little bit longer to process information. A person may also forget a word on occasion, or they may misplace important items from time to time. They may make a poor financial decision from time to time. They may forget to do something or forget that they've done something from time to time. But usually these little hiccups are not severe enough to impact function in a significant way. Now, how does this view of normal aging look different from potential signs of dementia? So, the main differences or distinguishing factors are going to be in frequency, intensity, overall progression, and abnormality of the behavior, okay? So if I occasionally misplace important items, this is considered normal, right? Especially as a person ages. And oftentimes when we misplace something, we know that we're the ones who had it last, and we're the ones who did something with it, in most cases. But the problem is we just don't remember what we did with it. But now, if I'm frequently misplacing important items, I have no recollection of even handling it, and now I'm blaming others for its disappearance. That is not normal, especially if it's happening often, okay? Also, if we think about familiar objects or familiar places that we interact with every day or frequent often, it's pretty rare that we forget what it's called or what to do with it, or if it's a place, how to get there and navigate around. So if now we're having difficulty going to places that we've always gone, or difficulty getting back home from places we've always traveled back home from, that's not normal. If we're beginning to forget what everyday objects are called that we literally interact with all the time, that is not normal. The same thing goes for language and communication skills. As a person ages, it is not normal for them to experience drastic changes in their language and communication abilities. Although as we age, it is true that there is that cognitive slowing, language skills do remain relatively intact, okay? So those are just a few examples. Now, if you are ever concerned about your memory or thinking skills, I highly recommend that you talk to your doctor about your concerns, or if you notice changes in someone that you care about, gently see if they would be open to visiting their doctor and talking about their challenges, okay? Because the reality is, although not everything that looks like dementia is dementia, it still may require attention for the person to be able to function at their best, okay? But that is all for today's video. I hope that you found it helpful. If you did, please be sure to like and subscribe as well as share this video. And for more content like this, feel free to join us in the treehouse at letsbamboo.com/treehouse. Until next time, bye guys.